Ever feel like you're like trying to speed run life but with blurry vision? Well, today we're doing a deep dive on LASIK consultations. So, whether you've got an appointment already or you're just kind of curious about what's involved, think of this like we're your buddies, your pre consultation buddies, to help you walk in there feeling prepped and ready and maybe even a little excited.
Yeah, it's amazing how much smoother things go when you feel like you've got, the information going in.
Totally. And we've got some excerpts here from a crazy thorough online guide, and we want to pull out the need to know stuff, right? So you can be really actively involved in this whole eye care journey. But full disclaimer, this isn't medical advice or anything, right? It's about giving you those questions to ask so you can have a good conversation.
Exactly. A really successful LASIK journey, it all starts with that initial consultation, wouldn't you say?
100%. And our source here, they kick things off talking about what actually happens during the consultation. Like, why is this meeting even so important? And they say it's about way more than just checking your vision like you do at a normal appointment. It's about figuring out, is LASIK even the right thing for you in the first place?
It really is. I tell my patients, sometimes it's like, when you've got those puzzles and you got to make sure all the pieces fit together just right. That's what we're doing here.
Hmm.
Eye health history, how stable is your prescription, the actual structure of your cornea. Those are all pieces of the puzzle we got to look at.
So it's not just like going, oh, I need new glasses, let me get my eyes checked. This is potentially changing how you see long term.
No
Yep.
pressure. Right, right. Huh? But no, seriously, that's why this first meeting is so crucial. We want to get the info, figure out what you're worried about, and make sure you're completely comfortable, before anything else happens.
Okay, so you've booked your consultation, you're feeling mentally prepped like we talked about. What should you actually expect when you walk in the door? Our source breaks it down into 5 main steps. Are you ready for the LASIK consultation playbook? All right, step 1, it's medical history time. And our source is like, honesty hour is now.
It's huge. People think, oh, I scratched my cornea with my fingernail like a decade ago. Who cares?
Yeah.
But trust me, it matters. Even tiny things can change if you're a good candidate for LASIK or not. Medications, old eye infections. Did your grandma wear really thick glasses? Tell them everything.
So no secret identities allowed in this appointment, huh?
Exactly. We need all the intel to make sure LASIK is the right move for you.
Deep divers, hearing this, no fibbing to the eye doctor. Okay, step 2, the comprehensive eye exam. Seems kind of self-explanatory.
You'd think so, but this is way more intense than your usual read the little letters thing. They're checking your vision, sure, but also your eye pressure, how healthy your retina is in the back. They even see how many tears you make.
Hold up, tears. That's a factor.
Big time. If your eyes are always dry, it messes with how you heal after LASIK, so we got to make sure you're good to go.
Wow. Okay, so we're talking like a full-on eye health inspection here, stuff you wouldn't even think about.
That's the point. We're gathering all this data to create your own personal LASIK plan.
All right, on to step 3. This is where it gets high-tech. Corneal mapping. Our source calls this step absolutely crucial. They're basically like, imagine making a super detailed GPS route, but for lasers. What's actually happening here?
They use this really fancy tech to make a 3D map of your cornea. Like they see its curves, how thick it is, super precise stuff.
So if the eye exam was like checking out the whole landscape, this is like whipping out a magnifying glass on every little detail.
Love that analogy.
Yeah.
We got to understand your cornea perfectly because that's how we customize LASIK just for you.
Right, the laser needs to know where to go. Okay, deep divers, you've been poked, prodded, mapped. What's next on this LASIK adventure?
Step 4 is all about setting expectations. Your surgeon walks you through the entire experience, how to prep for the procedure, what it feels like during, what to expect afterwards.
Like a behind-the-scenes sneak peek? I like it.
Hmm.
What kind of questions should our deep divers be asking at this point? This is your chance. Anything you're nervous about, confused by, recovery, risks, whatever, ask away.
100%. Don't be shy. This is about you. Even if it seems small, if you're thinking it, ask it.
Step 4, get informed, get comfy, get ready for step 5, and this one's all about you. Questions and concerns.
Your turn to really be involved. I always tell people, come in with a list of questions ready. It shows you're really invested in this whole thing,
Okay, so we've had all the official steps, right? But before we're done, I feel like we need that beyond the brochure section. Those insider tips, they don't always tell you, but they make a huge difference.
Oh, I'm all about those. One that comes to mind right away is communication style. Like, you want a surgeon who's skilled, obviously, but they also got to be a good talker. Someone who explains things in a way you actually get and feel good about.
Yeah, like imagine the best chef ever, right? But if you can't understand their menu, you might end up with a meal you hate.
Exactly. You got to feel heard. Don't be shy about asking about their experience, their whole philosophy on LASIK,
Yeah.
even if they've had patients like you before, prescription-wise.
Speaking of track records, is that something you'd tell people to look into, like a surgeon's experience?
Absolutely.
Yeah.
Find someone who, like, LASIK is their thing. They've got tons of experience, especially with whatever technology they're using, because LASIK tech, it changes so fast, even compared to a few years ago. You want someone who's up on all the latest stuff.
Right, like you don't want a chef who's still using Stone Age recipes.
Exactly. And last thing, even though our source mentioned it, I got to emphasize, understanding the risks. LASIK is super safe. It works really well. But any medical thing, there's always a chance something weird could happen.
It's like that saying, hope for the best, prepare for, well, you know the rest.
Right. A good surgeon will be upfront about that stuff. How would they handle it if something went wrong? That actually should make you feel more confident in them, honestly. It's all part of deciding if it's right for you.
Knowledge is power, people.
Right.
So, to wrap up for our deep divers today, we walk through those 5 big steps of a LASIK consultation, spilling the tea on your medical history, getting up close and personal with your cornea, the whole 9 yards.
We went beyond the basics, too, with those insider tips. Finding a surgeon who's skilled A&D, a good communicator, checking their experience, what tech they're using, and knowing the risks, even if they're super rare.
All amazing points. Now, as you head into your own consultation, armed with all this knowledge, take a second, really think, what are your vision goals? How does a LASIK fit in or not fit in with that? That's something to ponder. That's a wrap for today's deep dive, everyone. Thanks for joining us as we, totally demystified a LASIK consultations. Until next time, stay curious, stay informed, and most importantly, stay blurry vision free.